Chancellor of the Exchequer, Jeremy Hunt, has appeared on Sky News, where Sophie Ridge asked him about the health of the NHS.
I just want to have a look at the latest figures for A&E waiting times, because this really is pretty stark. This is the number of people waiting more than 12 hours in A&E in England. 43,000, I should say, 792 in October. I mean, frankly, this doesn't look like a health service that can find efficiency savings. This looks like a health service that, is on the brink of collapse.
There are massive pressures in the NHS. Obviously, it's something I know very well from previous jobs I've done. And I think that doctors, nurses on the front line are frankly under unbearable pressure. So I do recognise the picture you say. It's also true that there is a lot of money going to the NHS, and they will be the first to say that in a context where funding for the NHS is going up, we need to do everything we can to find efficiencies. But if you're saying to me the NHS is in a very, very tricky situation, I agree. And I care passionately about the NHS. I've spent more time thinking about the NHS than any other public service in my time in Parliament. And we need the NHS to help us get out of the economic difficulties we're in, because as you'll see in other parts of the Sunday papers, we've got a big increase in the number of people who aren't working, aren't taking part in work, even though they perhaps could. And sometimes that's as a result of long-term sickness. So the NHS is part of the solution, as well as facing some very big problems.
Jeremy Hunt did say something true there. He has thought a lot about the NHS. But that's only because he spent such a long time ruining it. Hunt was Health Secretary for 6 years, between 2012 and 2018. He served under both David Cameron and Theresa May, becoming the longest-serving Health Secretary in British history. He was also the one who inflicted the most damage on Britain's hospitals, patients and health workers. Let's start with A&E waiting time. So this graph shows the percentage of patients seen by English A&E departments within 4 hours of arrival. NHS rules state that 95% of patients attending A&E should be seen within that time. When Hunt took over in September 2012, NHS England was bang on target. But by the time he left in July 2018, it had dropped to around 85%. That translates to 3 times more people waiting for more than 4 hours when he left office than when he started. As you can see, things have only continued along the downward trend ever since. Now, Hunt, of course, was aware at the time that this didn't look good, but with the obvious solutions off the table, like paying doctors and nurses properly, Hunt came up with more novel solutions. The Guardian reported this in 2017. Jeremy Hunt considers barring walk-in patients from A&E. Now, the article goes on to say this. Dr. Helen Thomas, NHS England's National Medical Advisor for Integrated Urgent Care, said the Health Secretary was considering testing the data. Jeremy Hunt has mentioned to some of my colleagues, maybe we should have a talk before you walk, and we may well pilot that. Thomas told a conference according to a recording released by the doctor's magazine Pulse. Thomas admitted that even piloting the idea was a hot potato, but said early discussions had been held. I think it's been done in other countries where they've actually said you can't come into emergency departments until you've talked on referral, or you have to have that sort of docket that you're given by having talked on the phone that you do need to come to the emergency department. Of course, A&E waiting lists aren't the only measure of how the NHS is coping. In 2019, an Open Democracy article reported this. During Hunt's tenure as Health Secretary, the number of hospital beds, already low compared with those in most developed countries, dropped significantly, from 135,000 beds in the quarter that Hunt took over to 127,000 when he left, a loss of over 8,000 beds. Bed occupancy rates over 85% are considered overcrowding, and increased infection risks, cancelled operations and pressure on nurses. They peaked at record levels of over 90% in Hunt's last winter, and this was an average, with some hospitals repeatedly hitting 100%. Other targets, notably cancel referral times and waiting times for planned operations, also went from being comfortably exceeded to being missed every month under Hunt's watch. So those are problems that you can't solve by setting up a screening call centre. I don't think that's a very good idea for A&E. To mask the deterioration of the health service, Hunt wasn't averse to telling the odd whopper. This headline is from The Independent in October 2017. Jeremy Hunt forced a U-turn on mental health figures after making false claim to Parliament. The article went on to report this. In a statement on World Mental Health Day, Mr. Hunt told MPs, quote, "We've got 30,000 more people working in mental health today than we had when Labour left office." He later repeated the claim, saying, quote, "We have 30,000 more professionals working in mental health than when my government came into office." It subsequently emerged that he had inflated the actual number by around 43 times. And that wasn't the only time Hunt struggled with numbers. In 2015, he posted this on social media. We want 5,000 more GPs by 2020, the biggest chance for more investment in a generation, which will help deliver 7-day services. Hashtag GP New Deal. By the time Hunt left office 3 years later, he hadn't quite managed that figure because there were just 162 more GPs in the NHS. So missing that by quite the margin. Now, as for privatisation, well, Hunt loved that. So during his tenure, Hunt awarded £2 billion worth of NHS contracts to Virgin Care. And by 2018, Hunt had overseen a 57% rise in the amount of NHS funding being diverted to private firms. That included giving £12.5 million to a private US hospital to teach NHS hospitals how to raise their standards, only for it to fail its safety inspection a few months later. But that was just Hunt being consistent, because in 2005, he wrote a book with Kwasi Kwarteng and Michael Gove, amongst others, called Direct Democracy, an Agenda for a New Model Party. The book contained this from Hunt: our ambition should be to break down the barriers between private and public provision, in effect, denationalising the provision of healthcare in Britain. So that's what he wrote before he became Health Secretary. So we did have warning. While Hunt was adept at keeping business on side, he had the opposite effect on the medical profession. In 2015, Hunt tried to change the contract for junior doctors by increasing their working hours without increasing their pay. The BMA, the doctors' union, said it threatened patient safety, but Hunt was inflexible, forcing junior doctors to strike.
Save our NHS! Save our NHS! Save our NHS!
We're here because we want to send a message to Jeremy Hunt that these junior doctor contracts are not fair and they're not safe, and they're going to be the beginning of the end of the NHS.
We're here because the changes are unrealistic and it's going to cause danger to patient welfare, basically.
The new contract doesn't have the safeguards in place that we currently have, and you wouldn't expect airline pilots to be flying without checks to make sure that they're safe. So why should doctors not have the chance to have a contract that is safe and fair?
If you just read this, that says everything really about how hard you have to work to be a junior doctor and how you should be rewarded and how you should have a safe contract.
It's more about the safety, but antisocial hours and the payment absolutely as well. I mean, we all need to make a living as well, and we all have, dependents and mortgages and that sort of stuff to pay. The fact that now working at sort of 10 p.m. on a Saturday is going to be the same as working 3 p.m. on a Tuesday, I don't agree with.
There are many public sector workers across the country in different jobs who work exceptionally hard, and included within that is doctors. And to be expected to work more hours for less money is not fair either.
When negotiations failed, Hunt just imposed the new contract anyway, which led to half of junior doctors leaving the NHS after finishing their foundation programme in 2015. Now people wonder why the service has a staffing crisis. Having said all this, we should be fair to Hunt. In his defence, the Tories have proved perfectly adept at destroying the NHS even without him in office, and every metric he made worse has got even worse since he left the health department. 12 years of consistently assaulting the health service has caused such damage that the centrist General Secretary of Unison, Christine McAnay, posed a radical theory during this exchange with Sophie Ridge.
The latest figures that we showed to Jeremy Hunt on A&E waiting times show records number of people waiting more than 4 hours, and the number waiting more than 12 hours was up 30%, almost 44,000. What kind of impact could spending restraint have on the NHS? Could it be dangerous?
Of course it could. And you've just said it yourself there. Waiting lists are at an all-time high. We've got the biggest and highest level of public dissatisfaction with the NHS since it started. We've got 135,000 vacancies in the NHS. People are waiting in ambulances outside hospitals for 5, 6, 7, as long as 10 hours. They're basically using ambulances as another room of the hospital, which is not very an efficient use of ambulances. And this will have an impact. It's already having an impact on British people, and it will just only get worse. When I hear politicians talk about, difficult choices to be made, of course that's true. But there's also difficult choices. Well, difficult things will happen if we don't make the right choices and if they don't make the right choices. And one of those will be the NHS is almost ready to collapse. And excuse me for sounding like a conspiracy theorist, but I've heard so many people say it now. Is this partly a deliberate attempt by government to run down the NHS in order to turn around and say we'll have to bring in some private organisation to run it? Now, I hope that's not, and a bit of me thinks that's not what they're doing, but what they're not doing is taking the right choices about investing in our public services.
Ash, I want your opinion here. What should the public make of Jeremy Hunt going on TV pretending he's some champion of the National Health Service?
I think they should take their TVs and throw them out the window. I mean, it's beyond insulting. We've talked a lot about how the Conservatives, in reinventing themselves in office, have been both arsonist and firefighter. So they drive the country into a wall, defenestrate the leadership, and then say, oh, yeah, we're going to fix it. So that was the story of Theresa May, that was the story of Boris Johnson, that was the story of Liz Truss, and now that's the story of Rishi Sunak. What we're seeing after 12 years is that now the same individuals are coming in, like the very same individuals who created some absolutely catastrophic problems for our public services are coming back in and saying, well, you should trust me to be a responsible custodian for them now. I mean, Jeremy Hunt's handling of the NHS over his time as health secretary created some really expensive problems for us. So scrapping the nurses' bursary has meant that we have a shortage of nurses. The treatment of junior doctors meant that taxpayer money has gone towards training doctors, but now isn't going towards retaining them, so that, you know, we've kept them for the rest of their working lives and decent contracts and good conditions, which are, you know, equitable for them and also safe for patients. The false economy of austerity is that you've got savings in any given tax year, but costs which are being deferred later down the line and which are ballooning because the problems are so expensive to resolve. And so I think that Jeremy Hunt is now playing a bit of this game of saying, okay, well, the spending cuts won't really kick in until after the next general election. And, you know, we discussed this last week in terms of being an effective political tool, which buys them a bit of time and creates a bit of pressure for Labour. But I think there's a really fundamental question here about how Jeremy Hunt is being presented by our media. You know, I heard him sort of introduced by Laura Kuenssberg as, you know, he's meant to be a sort of sensible, responsible one. Well, how sensible or responsible was it to oversee an exodus of NHS staff without a plan of how to replace them? How sensible was it to look at the findings of Operation Cygnus, which modelled a respiratory disease-based pandemic, and then not take on any of the recommendations or heed any of the warnings? You know, that was Jeremy Hunt as health secretary. He's proved himself totally unfit to hold high office ever again. And it's only because the lot that have followed him have managed to be even more incompetent that he starts to look like a good option. You know, the same way that a plate of rotting meat looks like a more appetizing meal than literal dog shit. I mean, this shouldn't actually be an option for what you have for dinner.